Welcome to session 3, the natural history of cervical cancer and HPV infection. Before we proceed with the main lecture, I'd like to show a short video on the difference between a benign and malignant tumor. Here it is.
So, handa na ba kayo? At magsimula na tayong lahat. So, ano ba ang cervical cancer? Ang cervical cancer ay cancer ng cervix. Ang bukol ba at cancer magkaiba? Ang bukol o sa Ingles ay tumor ay isang swelling ng part ng katawan without inflammation caused by an abnormal growth of tissue na pupwedeng benign o malignant. Ano bang ibig sabihin ng benign at ano naman ang malignant? Kapag sinabing benign, ang benign tumor ay non-cancerous or ibig sabihin, hindi ito cancer. Ito ay nakakapaloob sa isang capsule or capsulated. Ang paglaki nito ay mabagal at hindi ito kumakalat or do not metastasize. Kapag sinilip ito sa microscope, ang mga itsura ng cells ay parang normal. Whereas, ang malignant tumor ay cancerous, non-encapsulated, ibig sabihin wala siyang capsule, kaya kumakalat siya sa mga karatig na tissue at sa ibang parte ng katawan. Fast-growing, ibig sabihin mabilis po siyang kumalat, at ang cells nito ay kakaibang itsura, na kung saan ang cells nito ay malalaki at may itim ang gitna or nuclei at may kakaibang hugis. Ngayong alam mo na kung ano ang pagkakaiba ng benign at malignant. So we'll turn now into the actual lecture, no? And this is based on the Pan-American Health Organization para maging standard po, no, yung ating mga lectures. So what is cancer? The term cancer is used to define an uncontrolled malignant autonomous growth of cells in tissue. So uncontrolled, walang yung cells out of their own control, basta lang lumalaki. So that is termed as cancer. This growth forms tumors that may invade other tissue around and cause growths similar to the original cancer in distant parts of the body. So ang ibig sabihin nito, ang cancer, it can grow and invade yung other organs, other space. It can go doon sa kulane, no, yung tinatawag nating lymph node, or sa blood vessels, para pag pumasok siya sa blood vessels, para na siyang nasa expressway. So umiikot na yan kahit saan siya pwedeng pumunta, sa liver, sa lungs, sa buto, sa brain. As cancer grows, it destroys the normal tissue and competes for nutrients. I guess ang payo ko lang dito, that's one of the reasons why we need to do screening, especially during pregnancy. Kasi pag merong cancer during pregnancy, it competes with the nutrients of the bata. So what happens is mas mabilis lumaki yung bukol. All the risk factors that causes changes in normal cells leading to cancerous are not completely understood. Well, I guess that's very much explainable. However, there are some established cancer risk factors that include tobacco, diet, alcohol, exposure to radiation, and in the case of cervical cancer, persistent infection with HPV na high risk. So ang message ko lang dito is for cervical cancer is HPV. And normally, isang risk factors ng mga pasyente na merong cervical cancer ay yung tobacco. Kasi mahal na mahal ni HPV yung mga babae na naninigarilyo kasi hindi ito mo ma-remove sa katawan mo out of your body if you are a smoker. No? Mamaya malalaman natin yan more clearly. How can cancer develop in the cervix uteri? In the previous unit, we have learned how through a process of squamous metaplasia, ito yung pag-change ng columnar into the squamous cell because nag-extrovert siya and na-prone siya sa acid. No? Alam natin yun. Nakita natin yun kanina. However, in a minority of women, this squamous metaplasia can evolve to an epithelium with precancerous cell transformation. These abnormal changes are usually generated by the infection with HPV. So it's the HPV that can cause the transformation of that squamous metaplasia into a dysplasia later on. Malalaman nyo yan mamaya. Makikita mo a minority because hindi lahat ng nagkaroon ng infection na HPV magtutuloy into cervical cancer. Some of the women will be able to shed off the infection. Mababalik yan sa normal. Mamaya, that will become evident sa inyo and very clear. Now, what is the human papilloma virus? No? The human papilloma virus belongs to a family of viruses that is transmitted sexually, sexual contact, and can affect men and women. And this is one of the reasons why yung bakuna, binibigay natin yan bago makipag-sexual yung bata, yung edad na yun. Kasi pag nakapasok na, then hindi na masyadong effective. There are many HPV viruses. No? The infection with these viruses can go away or persist. Yan yung sinasabi ko why there is a minority. Some women, they shed off the viruses and it can go away. Some persist. Yung nag-persist, that becomes cervical cancer. Ito, persisting HPV infection can cause genital warts and different types of cancer. Sa vulva cancer, vaginal cancer, penile, anal, rectum, and oropharyngeal. And that is very true. Klaruhin ko lang. No? Number one, may mga iba-ibang klaseng HPV infection na nagkokos ng genital wart at ng cancer. Magkaiba yan. Yung nagkokos ng genital wart, ang tawag natin dyan, low risk. Ang tawag natin dito sa nagkokos ng cancer, high risk. Kasi high risk kang magkaroon ng cancer. No, anong klaseng cancer? Hindi lang babae, hindi lang babae at lalaki. So sa babae, you will get vulvar cancer. Ito yung pisngi, no, ng puwerta. Vaginal, alam niyo yan, puwerta. Cervical, alam niyo yan, cervix. Sa lalaki, anal, penile, at oral cavity. Also, babae can also get anal and oral and mouth carcinoma because of HPV. I guess one person to show is Michael Douglas. Michael Douglas had HPV of the oral cavity. However, the biggest impact of HPV on population health is its relation with the majority cases of cervical cancer in women. Ang sinasabi dito, marami kasi. Halos lahat ng cervical cancer ay dulot ng HPV. Yan. Now, there are many types of HPV. Hindi nakasaad dito yung tinatawag nating cutaneous. Ito yung mga nakikita nyo sa paa, sa mukha, sa katawan. Walang problema doon. It will not develop you into any form of cancer. Ang medyo matakot ka dito sa low risk at saka dun sa high risk. Bakit? Low risk, ito yung nagpo-produce ng kulugo. So kung nakakita ka ng kulugo sa area ng ari, sa puwet, sa ari ng babae, ari ng lalaki, definitely this is sexually transmitted. And ang cause niyan is HPV 6 and 11. They do not cause cancer. But in reality, some of them can turn into cancer. Kasi medyo older na to eh. Newer study says, no, low risk some of them can cause cancer. Pero low lang, kaya nga low risk eh. High risk. So high risk kang magkaroon ng cancer. Ang problema dito, mga wala itong simptomas. Basahin ko. Persistent infection with one or more of these types can cause cervical cancer and in a lesser extent other cancer types. So yung iba dito, pag nagkaroon ka, no, lalo na yung HPV 16 and 18, very likelihood magkakaroon ka talaga ng cancer. Especially pag naging persistent at hindi ka immune dun sa 16 and 18. You will develop cancer later on, most likely. Now, the main cause of squamous cervical cancer or precancer is the persistent infection. Yan ang sinasabi ko. If you can shed the virus, hindi ka magtutuloy ng cancer. But if you will have a persistent infection, becomes dysplastic, and then later on oncogenic na, no, magkokos na yan ng cancer. There are more than 100 types of HPV na sinasabi ko. Yan yung kasama na dun yung cutaneous and yung low risk and high risk na dyan. Ang pinaka-common sa high risk is HPV 16 and 18. It causes 70% of cervical cancer cases. There are other 4 types, 31, 33, 45, 58, are the less commonly related cervical cancer. Don't worry, hindi kayo bibigyan ng exam dito. There are other also, ito yung mga low risk na tinatandaan. Yung 6 and 11, ito yung most commonly nagkukos ng genital warts, ng mga kulugo sa ari. Ito yung kulugo na sexually transmitted. Men also develop cancer of the anus. This is more commonly associated with HPV 16 and is more common in men having sex with other men. MSM, men having sex with other men. That's the thing nowadays. Hindi lang HIV ngayon ang kinakatakutan nila, but also HPV, because they can get anal cancer. If you are watching Charlie's Angels, yung pinaka-original, sila Jackie, I forget, Jacqueline Smith yata yun, no? And there's this girl, beautiful girl, sexy girl, Farrah Fawcett. She died of anal cancer, and just wanted to point out yun. So how is HPV transmitted? Again, it's sexually. It's a very common infection, and most men and women will get infected shortly after they become sexually active. Ang problem nito, most of the patients ninyo sabihin nila, HPV, ano yan? Kinakain ba yan? It's mainly because they don't have the symptoms. When you don't have the symptoms, ang question, pupunta ba sila sa inyo? The answer is no. So they don't know. So you have to teach them, tell them that. Although penetration to the penis, to the vagina or rectum is one of the main ways of HPV transmission, the using condom confers some protection against transmission. The infection can also occur by skin-to-skin contact of the genital areas. Mainly kasi ang transmission nito is skin-to-skin. So you can transfer this into 4 ways, I think. Vaginal sex, oral sex, anal sex. Ano yung isa? Digital sex. Ibig sabihin, hinawakan ko, meron ako, HPV, na high risk, ipinasa ko, isinundot ko, pwedeng matransfer. Sex toys, pwede also yan. No? Yung mga ganong possibilities. HPV infection are usually asymptomatic and they are usually short-lived. Usually, sinasabi. But how do you know na short-lived yan sa'yo? Yun yung sinasabi ko. Your immune system normally sheds it off. Paano kung hindi? Wala ka namang simptomas, hindi ka nagpa-screen. 10 to 20 years after, di ba? You will develop cervical cancer. Boom! Dinugo ka by the time you have already late stage. Then by the time you come to us, to a doctor like me, radiation oncologist, you are already 2, 3. Then nagbayad ka na ng mahal, you have a lesser chance na buhay ka in the next 5 years. Which factors favor HPV infections? Ano yung mga bagay-bagay na nagpapabor ng HPV infection? So number 1, makikita mo dito, the transformation zone on the cervix is particularly vulnerable. It's the transformation zone of the ectocervix, no? Yung pag lumabas na yung columnar mo, cells mo, yung ectroprion, if you remember that, na subject sa acidity, mag-metaplasia. Pag nag-metaplasia, nakipag-sex ka. Usually during puberty and pregnancy, malaki yung transformational zone mo, nakipag-sex ka, and may infection yung partner mo. Boom! You get the infection. Pasok yun kaagad doon sa cells ng transformational cells mo dun sa area na yon, and you are that infected na. And this is one of the reasons why nakikita natin to. Yan, makita mo, this can explain the existing relationship between squamous cell cancer and early sexual activity. So kung maaga ka nakipag-sex, mas prone ka kasi pag puberty, malaki yung area ng transformational zone. Young age also, at first birth, no, that's also one, no, and history of multiple pregnancies. Kung marami kang anak, maraming sex, sigurado maraming chance, no, na magkaroon ka ng infection. Now, having multiple sexual partners increases the risk of HPV infection, and thus cervical cancer. So, syempre, natural yan kung marami kang partner, marami kang chance na yung mga partners mo may HPV and they can also pass that on to you. Also, yung partner mo can also have other partners then in the past and they might have HPV and they can pass that also to you. Now, what favors persistent HPV infection? Remember, persistent is the word. Persistent is key. No? Parati kong sinasabi yan, persistent. Kasi, pag persistent, HPV goes away normally. If it doesn't go away and it becomes persistent, then you will develop the cervical cancer. Yan, parati ko nang inuulit-ulit yan. Okay, ano yan? HPV type. Kung ang nakuha mo ay yung mga 16, 18, 41, 33, 35, yung mga nabanggit kanina, no? Yung 14 na high risk, then you are likely to get cervical cancer. Kung immune status mo mababa, kung ikaw ay may HIV, hindi ito yung mga nawawalan ng buhok, hindi hair is vanishing. I'm referring to human immunodeficiency virus, no? Yung mga merong ganon syndrome, yung mga AIDS. Mas immunocompromised sila, they are at high risk. So, yung mga pasyente yung may cervical cancer, AIDS, high risk sila, so dapat nyo silang mas i-monitor. Co-infection, kung ang pasyente nyo ay meron nagkaroon na ng mga ganyang STI. Kasi normally magkakasakasama yan, magkakabarka-barkada yan eh. Herpes simplex, chlamydia, gonorrhea, pag pumasok yan sa'yo, then most likely meron ka na ring HPV. Yun nga lang, these things, they have the symptoms, itong herpes simplex, chlamydia, gonorrhea, but yung HPV, wala. Okay. Parity, yung young age at first birth, we've discussed that already. Tobacco smoking, already discussed that. Mahal na mahal ka, hindi mawawala sa'yo si HPV kung ikaw ay naninigarilyo ka. So, it becomes what? It becomes persistent. And also the use of oral contraceptive pills for over 5 years. Kung ikaw ay nag-OOCP, hindi ko naman sinasabing itigil mo yan. Ang sinasabi ko lang is magpa-screening ka naman kasi you are at high risk. Now, cervical cancer, no, from what you have learned above, no, you probably will be able to understand that cervical cancer is a special type of cancer because most cases are caused by a persistent viral infection with human papilloma virus. Especially, yan, very, very common, 16 and 18, 70% of cases, sila ang dulot, salot ng cervical cancer. Ito, makinig kayo. The natural course of progression from persistent infection with HPV to invasive cancer is around 10 to 20 years. Kadalasan, marami yan ang mga mag-aasawa nag-aaway because pinapasa sa asawa yung dahilan bakit sila nagkaroon ng cervical cancer. But in reality, no, 10 to 20 years pa. No? Kung ikaw, aminin mo, marami kang partner, maaring isa doon nakuha mo yun. Or baka naman kung siya lang talagang bukod tangi and then baka talagang sa kanya talaga. Okay? This provides additional opportunities to address cervical cancer prevention and control. Cervical cancer is a disease that can be prevented and that's why we are all here. We want to prevent and eliminate. Therefore, public health intervention can be really effective in targeting this disease. Even when cancer develops, it can still be cured if it is detected early and treated. The word here is early. Kung stage 1 ka, maganda laban mo. I believe you have around 85 to 90% na laban. But when you go down to stage 2, stage 3, it drops to about 60 and it drops to about 30%. There are several and affordable options for detecting cervical cancer. Yan. Moreover, HPV vaccine are also available. So, ipapasa natin sa inyo later on yung HPV vaccine. And para kayo ay makapagbigay din ng bakuna sa inyong mga pasyente. If given to girls before they are sexually active, can prevent a large portion of their cervical cancer. Again, it's being pointed out here that the vaccine should be given before sexually active. Now, we go now to HPV infection and to the natural history of cervical cancer. When the HPV enters into the cervical epithelium, it interferes with the normal function and leads these cells to are characteristic to pre-cancer. Ang ibig sabihin nito, yung HPV kapag nasa metaplasia siya, no, pumasok na, it interferes, nakikialam siya dun sa normal function, and that can lead to another form of cell which is tinatawag nila ay pre-cancer or a dysplastic cell. Now, it can take years to progress from a normal uninfected to pre-cancer to an invasive cancer. Ang message dito is from at the time na magkaroon ka ng normal ma-infect yun down to pre-cancer, it takes years, minsan mga 10. And another 10 years from pre-cancer to invasive cancer. Ang point dito is screening ninyo. Because if we're able to detect people who are already in the pre-cancer, we can already save them. Kasi pag pumunta na sila sa invasive cancer, then bumababa na ang chances nila na sila ay masisave natin. Hindi na 100%. No? Ito ang sinasabi ko kanina. Many of these changes are reversible. So pag nakapasok na si HPV sa cells ninyo, pwede yan ma-reverse. Pwede yan pumunta sa maging infected, pwede yan maging pre-cancer. Ang tawag doon ay progression. Pwedeng mag-regression. Ibig sabihin, from a pre-cancerous, pwede niyang bumaba into an HPV-infected cells. Ano bang ibig sabihin yan? Clinically, makikita nyo dyan, masasabi ko sa inyo, is when you are using now the VIA, no, meron yung mga portion na sinasabi namin na yung pasyente nyo are CIN1, and then anong ginagawa namin, pinapascreen namin sila ulit sa inyo, pinababalik namin sila ulit sa inyo after 6 months. Kasi baka mag-regress. Pag nag-regress, hindi na magtutuloy yon, no? So, back to the screening. Ngayon, kung talagang ito ay pre-cancerous talaga, then probably we might do an intervention called biopsy, or it depends upon the OB kung gusto niya ng cryotherapy or other forms of treatment. Yun ang clinical significance noon. That is why it is very important na maintindihan ninyo. Now, this is the pathophysiology of the intraepithelial squamous lesions. Cervical precancer or CIN, tinatawag, are dysplasia. Ang dysplastic cells doon are from the basal, yung basal membrane of the squamous epithelium of the cervix. Basal is yung pinakailalim, if you remember kanina. They precede cervical cancer and are classified into severity as low grade, LSIL, or CIN1 or HSIL. Hindi nyo na malalaman yan because these are pap smear. These are pap smear results, no? Hindi nyo makikita yan sa VIA. Now, progression to invasive cancer, sa akin na no, normally yung mga nakikita ko. From the cervix, it can progress to the entire cervix. Pwede yung kainin yung buong cervix, pwede niyang kumalat yan paakyat sa uterus, pwedeng bumaba yan, no? So, sa vagina, no? So, that's what we call two adjacent structures. Pwede niyang pumunta yan sa pantog, pwede yan pumunta sa harapan, which is nandyan yan sa infect yung mga intestines mo, no? It can also go into the lymphatics. Lymphatics is kulani. Lymphatic metastasis ang tawag dyan. Now, kapag nakapasok na yan sa blood vessels, that's what you call as distant metastasis. This slides now shows the progression of cancer to more invasive. So makita mo from the cervix lang, from the first slide, lumalaki, it becomes bigger now, and then it becomes bulkier, no? So lumalaki na yung cervix mo. That's what we call as late stage 1B bulky tumor. And then sometimes it even affects the parametria, no? Yung side walls, so nakikita mo as shown, no? So that's already stage 2, no, pagdating sa ganon. So in conclusion, no, cervical cancer is caused in almost all cases by persistent infection with high-risk HPV. So, lahat yan, halos lahat ng cervical cancer is caused by HPV. The transformation zone is especially sensitive to HPV infection. Doon yun nagsisimula, sa TZ. Okay. Although not all HPV types causes cancer, there are a number of high-risk HPV types, especially itong 16 and 18, which is responsible in 70% of cases. Yan ang grabe, yung dalawa na yan. The HPV infection causes intraepithelial lesions that advance from the base to the top layers of the epithelium and can evolve to cancer. No? So, ibig sabihin, yung infection mo, nandiyan muna yan papasok yan sa epithelium mo, bababa yan dun sa basal, then later on, magde-develop into cancer, and now pwede na siyang kumalat. The natural course of progression from persistent to HPV again is 10 to 20 years. Tandaan niyo yan. And nabanggit natin kanina yung modes, routes of invasive pag-progress ng invasive cancer. From initially sa cervix lang, then adjacent structures, then sa parametria, then later on sa blood vessels causing metastasis.